More than 1,000 Kenora residents will lose their primary care this summer. A local physician is closing his family practice there in order to focus on street medicine full-time. Dr. Johnny Greck says he's hoping the change will be best for the overall health of the community.
Kenora is really this sort of microcosm, or a really interesting environment and climate for people who use drugs, with fairly limited or lots of gaps for people to fall through in the healthcare that they receive. And as a consequence, I think we're not only doing those people an injustice, but the town in which they live.
Greck will shutter his family practice at the end of July, and although there are 9 other doctors still practicing at the Patterson Health Center, they don't have the capacity to take on most of his 1,200 patients. Greck says the decision was a difficult one, but he feels he can do the most good by working with people who are facing homelessness or struggling with addiction.
We're right here at potential breaking point. But out of that, I think we're going to see this wonderful kind of butterfly transformation, and I really want to be part of that in a compassionate way. It's lovely to think that Kenora could actually be a kind of a leading light in that, to say hey, despite our differences and despite obvious and significant and awful trauma which needs to keep being discussed, it's possible to find a place in reconciliation through health and social services for all people.
Greck says he and his street outreach team will focus on making sure people can access the addictions care that they need and on being more strategic, collaborating with other organizations and making prevention and education a priority.